Stop everything. I'm exposing the life-saving secret your cardiologist hopes you never learn. Imagine this terrifying scenario. You're alone. A crushing weight slams onto your chest. Your left arm goes numb. You can't breathe. You're having a heart attack with no one to help. This nightmare happens to over 380,000 Americans yearly. Most panic and freeze, sealing their fate. A groundbreaking study found seniors who knew what to do in the first 60 seconds of a heart attack increased survival by an astonishing 73%. That's right. 1 minute of preparation can literally be the difference between life and death. The system you're about to learn is not a myth. It's 7 scientifically proven techniques backed by cardiologists at Johns Hopkins and the Mayo Clinic. We'll show you the emergency door protocol that is proven to reduce paramedic entry time by 8 minutes, and the specific aspirin protocol that makes the medication work 50% faster. But the number one most important tip: researchers at Harvard Medical School discovered that this single, counterintuitive action gives you the same survival advantage as having a paramedic right there in your living room. It has absolutely nothing to do with medication, yet it's so powerful that emergency dispatchers are now being trained to coach you through it. If you have any cardiac risk, this video is the most important thing you will watch this year. Drop your age in the comments now and let's start preparing for the worst so you can hope for the best. The reason 89% of people fail to survive a cardiac event when alone is not a lack of strength, but a lack of strategic clarity. When a heart attack strikes, panic is your first enemy. As your heart rhythm becomes dangerously irregular or a coronary artery blocks, your brain starts losing oxygen within seconds. The Journal of Emergency Medicine tracked 500 heart attack survivors over 60 and found a terrifying fact. 67% couldn't remember their own address when calling 911. This is not memory loss, it's instant cognitive impairment due to oxygen deprivation. You have a window of about 60 to 90 seconds before confusion and physical debilitation set in. Your preparation must account for this terrifying reality. If you rely on your memory during the crisis, you will fail. The system we are providing bypasses panic by turning critical steps into muscle memory and visual prompts. These 7 techniques are designed to buy you 8 to 12 minutes, the average emergency response time, by maximizing blood flow to your brain and minimizing heart muscle damage. We must first address the most common and deadly delay: communication and access. Your first 2 steps, taken immediately, are about ensuring help can find you and get inside quickly. This step seems basic, but it is absolutely critical and often the factor that determines survival. This is technique number 7, the emergency access protocol. Paramedics arriving at your home but unable to get inside is a terrifying reality that kills thousands of seniors every year. A study from the Journal of Emergency Medical Services found that locked doors delayed treatment by an average of 11 minutes, with 34% of cardiac deaths in seniors happening because help couldn't reach them in time. Here's exactly what you need to do in the first few seconds of symptoms. Unlock your front door immediately. Walk to your door while you still have strength and coordination, unlock it, and leave it slightly ajar if possible. The University of Pennsylvania found that patients who unlocked their doors as their very first action had 47% better survival rates than those who waited until after calling 911. Why? Because the average person loses the ability to walk within 3 to 5 minutes of a major heart attack starting. Once you're on the ground, you're not getting back up to unlock that door. The preparation secret. To prevent this delay, you need to prepare now. Program 911 into speed dial as number 1 on every phone. Write your complete address and any gate codes on a bright index card and tape it next to every phone. Finally, mount a key lock box outside your home. Give the combination to your local fire department, or use a smart lock that can be programmed to unlock when 911 is called. These actions cut the time to treatment by precious, life-saving minutes. When panic and confusion set in, you need a fail-safe communication plan. This is technique number 6. Master your emergency communication system. This isn't just about having a phone nearby. It's about strategic preparation for cognitive failure. The American Heart Association found that 43% of fatal heart attacks in seniors happen between 10 p.m. and 6 a.m., when phones are often charging in another room. The fatal mistake: relying on speaking your address or medical conditions during oxygen deprivation. The preparation secret: written prompts. You've taped your address next to the phone, from Technique 7, but also create a brightly colored emergency information sheet listing your name, key medications, especially if you take blood thinners or nitroglycerin, and known allergies. Tape this sheet to the inside of your front door at eye level. The American College of Emergency Physicians found that visible medical information reduced treatment delays by 26%. Wearable tech. If you live alone, you need a medical alert device. But here's the crucial detail most people miss. The National Institute on Aging shows that 31% of seniors who own these devices are not wearing them when their cardiac event happens because they took it off for bathing or sleeping. Get a waterproof device and wear it constantly. Noise signal. Keep a whistle attached to your keychain and in your nightstand. Even if you can't speak, making noise helps first responders or neighbors find you, reducing search time by precious minutes. These steps ensure that even if you can only manage a whisper or a weak movement, the essential information and access are already waiting for the paramedics. Everyone knows about taking aspirin during a heart attack, but what most people do not know is the specific way to take it that makes it work up to 50% faster. This is technique number 5, the chewable aspirin protocol. When a heart attack strikes, it's usually caused by a blood clot in your coronary artery. Aspirin is a powerful platelet inhibitor. It makes your blood less sticky, preventing the clot from growing and helping blood squeeze past the blockage. A massive study in The Lancet involving 17,000 heart attack patients found that taking aspirin within the first hour reduced death rates by 23%. The crucial secret: you must chew the aspirin, not swallow it whole. Swallowing a whole tablet, especially one with an enteric coating, means you're waiting for it to dissolve in your stomach, which can take 20 to 30 minutes. Chewing breaks down the coating and increases the surface area, allowing it to be absorbed rapidly through the rich lining of your mouth. Research from the University of California, San Diego, showed that chewed aspirin reached therapeutic blood levels in an average of 14 minutes compared to 26 minutes for swallowed tablets. Those 12 minutes matter when heart muscle is dying from lack of oxygen. The dose. The correct dose is 325 mg, 1 regular strength tablet or 4 baby aspirins. The preparation. Secret: keep non-coated aspirin in multiple easy-to-reach locations like your nightstand and wallet. If you are already taking a daily preventative dose of 81 mg, you still need to take the full 325 mg dose during the acute event. Your body's position during a heart attack is not trivial. It's a scientifically proven factor that can significantly buy you time until paramedics arrive. This is technique number 4. Assume the cardiac position. The European Resuscitation Council published guidelines showing that proper positioning can maintain blood pressure and consciousness up to 40% longer during certain cardiac events. The correct position: if you are experiencing symptoms, do not lie flat on your back immediately. That position can actually reduce blood return to your heart and worsen symptoms. Instead, immediately sit up at about a 45-degree angle, propped up against a wall or using pillows on a bed or couch. Your knees should be bent with your feet flat. This is called the semi-Fowler's position, and it helps in 3 crucial ways. It reduces the workload on your heart by using gravity to assist blood flow. It makes breathing easier by allowing your diaphragm to expand fully. It helps prevent fluid from backing up into your lungs, a complication that can occur during heart failure. A study from the Tokyo Medical University found that patients who maintained this position had 35% better oxygen saturation levels compared to those who lay flat. Immediately loosen any tight clothing, undo your belt, unbutton your collar, and remove any tie or scarf. The Journal of Cardiac Nursing found that something as simple as loosening a belt can improve blood oxygen levels by up to 8% during cardiac distress. Your natural panic response during a heart attack is your enemy. The instinct to hyperventilate with rapid, shallow breaths actually reduces the amount of oxygen reaching your heart and brain. This is technique number 3, The controlled breathing method. Stanford University Medical Center conducted a study that found cardiac patients who used controlled breathing techniques during their attack had 45% less heart muscle damage compared to those who hyperventilated. The technique is called paced diaphragmatic breathing. Here is the precise rhythm you must master now. Inhale. Breathe in slowly through your nose for a count of 4, feeling your belly expand. Hold. Hold that breath for a count of 4. Exhale. Exhale slowly through pursed lips for a count of 6, as if blowing out candles in slow motion. The longer exhale is crucial because it activates your parasympathetic nervous system, which slows your heart rate and reduces the oxygen demand on your heart muscle. Mayo Clinic research confirms this pattern can lower your heart rate by 10 to 15 beats per minute during an event. Practice this breathing pattern for just 5 minutes daily now, while you are healthy. The American Journal of Cardiology reported that patients who practiced controlled breathing beforehand were able to successfully use it during cardiac events 78% of the time, compared to only a 12% success rate for those who tried to learn it during the actual emergency. This is the controversial technique that has been widely debated, but recent research provides clear evidence on its limited but potentially life-saving use. Technique number 2, the cough CPR technique. This technique is not a substitute for calling 911 and is only effective if you are still conscious and experiencing a specific irregular heart rhythm, arrhythmia, where the heart is beating inefficiently. It will not help a complete blockage. However, a study from the Ping Union Medical College found that patients who used this technique correctly during the early stages of an attack maintained consciousness for an average of 92 seconds longer than those who did not. That minute and a half can be the difference between making the call to 911 or collapsing before the phone connects. Here is the precise, life-saving method. At the very first sign of symptoms, before consciousness is lost, you must take a deep breath, as deep as you possibly can. Then cough hard and deep like you're trying to cough up something from deep in your chest. The cough must come from your diaphragm and be forceful. Repeat this cycle immediately and continuously every 2 seconds. Breathe in deeply, cough hard. What's happening is fascinating. Each deep breath brings oxygen into your lungs, while each forceful cough creates pressure that manually squeezes your heart, keeping blood circulating to your brain. The Cleveland Clinic emphasizes that this technique is most effective in the first 30 to 60 seconds of symptoms. It buys you precious, irreplaceable time to complete the most important step of all, which we will reveal next. This is the number 1 most important technique, the one that the Harvard Medical School study exposed, which gave patients the same survival advantage as having a paramedic in the room. This is technique number 1, the immediate nitroglycerin protocol. If you have any cardiac risk factors, being over 60, high blood pressure, diabetes, or high cholesterol, you must talk to your doctor about emergency nitroglycerin. The key word here is correctly, because most people who have it don't use it right during an emergency. Nitroglycerin works by rapidly dilating your blood vessels, reducing the workload on your heart, and improving blood flow through partially blocked arteries. It can literally stop a heart attack in progress if the blockage isn't complete. A massive study in the British Medical Journal showed that early use reduced mortality by 35% and the size of heart muscle damage by up to 50%. The exact protocol, you must memorize this. Sit down immediately. Never take nitroglycerin standing up, as it can drop your blood pressure quickly and cause you to faint. Place 1 tablet under your tongue, not on top. It absorbs through the rich blood vessel network there. Don't swallow it. Wait 5 minutes. If symptoms haven't improved significantly, take a second tablet. Wait another 5 minutes. If symptoms persist, take a third tablet and call 911 if you haven't already. Never take more than 3 tablets in 15 minutes. The crucial prep secret: always chew your aspirin first, technique 5, before taking nitroglycerin. The combination provides maximum benefit. Johns Hopkins reported that patients who used both correctly had 58% better survival rates than those who used just one. And remember, store it properly in its original amber glass bottle and replace it every 6 months, even if unused, because it loses its potency quickly. The difference between surviving a heart attack alone and becoming a devastating statistic is not fate. It is preparation and knowledge. We have exposed the 7 scientifically proven techniques that take advantage of those precious first few minutes to maximize your survival odds. From the emergency access protocol that gets paramedics through your door faster, to the chewable aspirin that works 50% quicker, and finally, the immediate nitroglycerin protocol that mimics in-room paramedic care. The terrifying truth is that you can't learn these steps when your brain is starved of oxygen. You must internalize them now. Your biggest action step is not watching this video again. It is taking the preparation pledge today. Run through the breathing exercises daily. Check your aspirin and nitroglycerin supplies monthly. Go to your front door and visualize yourself performing the unlock protocol. Your heart and your loved ones will thank you for being prepared. Now we need to hear from you. Have you experienced a heart emergency while alone? Share your story below. It might just save someone's life. Like to push this information to more people and subscribe for more secrets.